Specialty Dental Centers is a multi-specialty group practice that includes oral surgery and prosthetics at this time, primarily focused on being able to provide implant-based major reconstruction services for patients that need more extensive, involved, comprehensive treatment. Implants have revolutionized dentistry to the point where we now have a number of things we can do with them. The important thing about implants is they are titanium-based replacements for the roots of teeth, and when they're placed, they can then be utilized for virtually any type of restorative procedure. The idea is that patients that will be seeking these services are more end-stage, few alternatives to reconstruction or ability to rehabilitate, reconstruct their dentition and bite. So for functional purposes, it allows us to provide a fairly comprehensive, fast, full scope of rehabilitation.
My name is Thomas Carr. I live here in Casper, Wyoming. Live out in the country. Teeth I have are inadequate, totally. I have 2 partials and the rest of my teeth need to come out and go away. Up till now, it's been difficult to eat, but after this procedure that I'm really looking forward to, I should be able to eat anything I want and life will be much better. The staff here is wonderful and the information they've given me is great. Each time I learn more about what they're going to do and how they're going to do it, so there's really no question in my mind how this has come down. They've been extremely helpful.
One of the major features of specialty dental centers is we have on board specialists that would be able to handle almost all degrees of complex services at one location.
Prosthodontics is the specialty that deals with restoration or replacement of teeth. And so that can range from restoration of a damaged tooth all the way to replacement of missing teeth, whether that's one tooth or all teeth. So it really encompasses a wide variety of treatment aspects. One of the unique features of our office here is the fact that you have treatment provided by multiple specialists in one location. So for many people, they have to travel to several different offices to receive this type of care. Utilizing our laboratory's assistance, we can accomplish all of that so that you would come in the morning for the procedure and you would leave that evening with essentially a restored set of teeth. We have a fancy 3D scanning machine that allows us to look at 3-dimensional x-rays of jawbones. So normally at your dentist's office, when they take an x-ray, it shows them only 2 dimensions. So we can see some of the aspects that we're looking at, but not everything. Well, here we have a 3-dimensional x-ray that really allows us to do all of the planning ahead of time, so we know exactly what we're looking at, and it eliminates the need for exploratory surgeries and guessing that used to be standard in the industry. Now all of that has been eliminated and we're able to do all of the planning ahead of time and really make the process much simpler for everybody.
My name is Cindy Batchelor-Broger. I will be 46 years old. My teeth have always been loose. They've always been soft. They just, all the roots show constantly. Very tender, bleeding of the gums constantly. I can brush my teeth umpteen times and it still bleeds. The reason why I came to Dr. Ripley, I feel that he's very professional in what he does, and I feel very confident in his procedures. As an end result, I'm expecting and hoping that I have gaps in my front teeth would be nice, be able to chew real food and be able to swallow it, because usually I just cut my food small enough to eat, not really chew it, but to swallow it. This is going to give me a second chance, basically. It will boost my confidence level. I think it'll help my job performance. It will self-esteem. Everything. It'll just give you a release on bite.
I see patients for a number of different reasons. It can be anything from a simple progression of a cavity on a tooth that's progressed to the point where it needs more advanced treatment to fix that tooth. Occasionally we see patients because of neglect issues, various other problems. Sometimes periodontal disease, gum disease, can cause loss of teeth. All of those things can lead to damage to teeth or loss of teeth that may require my assistance to restore them to a normal level of function.
This procedure happened yesterday. This is the next morning when I came back in to get some final adjustments. And all in all, it went very well, and I'm perfectly happy with my new teeth. So the only surprise I think I had was how little pain I had and little swelling, and it turned out quite well, actually, better than I fully expected. And I'm sure everybody's going to have to see me smile, which won't be too difficult since I now have teeth to show off. It shouldn't be bad at all.
Once the implant is integrated, it's solid and is permanent. In the last 15 to 20 years, the science of implants has become very, very well defined. It's no longer considered an experimental type of procedure. And so the use of implants has really revolutionized the ability of dentistry to restore the mouth and the dentition overall.